26 minutes past 8. Now, earlier on this morning, we were talking about the repercussions that the lockdown's having on younger people in our communities. It seems that while our kids and young people seem less likely to get COVID-19 than older adults, there may be substantial indirect adverse effects on their physical and mental health. Well, the YMCA Exeter is offering early intervention support for young people and their parents and carers to address this. Let's talk to Gareth Sorsby from the YMCA in Exeter. Good morning, Gareth.
Good morning, Laura. Thanks for having me.
Well, thank you for coming on. What sort of long-term conditions are we talking about here?
We're actually talking really low-level intervention, so focusing on the prevention and as you start to spot signs that things might go in a slightly wrong direction, how can we intervene there and equip you with skills? So we're talking about anxiety, stress, low mood, phobias, even sleep problems and OCD. And many people don't see those issues as mental health, but all of those things contribute to our long-term mental health. So it's about getting in there as quick as possible. And there's services for young children from 5 right up to 18 and their parents. And it's anything we can do there to give them the resilience they need to build more hopeful futures.
So what sort of service is being offered then, and by who? Is it just support, or will you pass this on to other people?
So there is a process to go through. It's a free service, and we have 2 wellbeing practitioners that are, it's a national government-led initiative to bring more services to young people earlier on. It's in partnership with Exeter University. So we've got 2 trainee wellbeing practitioners. One of them's already got a child psychology degree. So they would do one-to-one sessions with young people. They do some sessions with parents as well. At the moment, that's always over the phone or online. We're hoping to get back to doing some face-to-face stuff soon as well. And it's really about equipping people with the skills to be able to look after their mental health longer term. So it's CBT focused. So it's all about your emotions and behaviours and how we can help you challenge and change some of those things.
And for parents as well, who might not even notice that there's anything different about their children, because children, are quite tough sometimes and do hide things, or maybe show their problems in different ways. And you mentioned the age 6 to 18. We're doing homeschooling with my 6 and 9-year-old, and yesterday, and I heard that I'd be talking to you today, and I thought I'll definitely remember to bring this up. Our school gave us a book to read called Lucy's Lockdown, and it's a recent book, I believe, but it's about a little girl called Lucy. And she's probably about 8 years old. And whenever she's got a different emotion, a different feeling, her hair changes colour. So if she's feeling sad, Lucy's hair turns blue. If she's angry, her hair turns red. If she's happy, calm, it turns green. And it was just a really visual way for my little 6-year-old, who doesn't really understand why it's important to talk about feelings, to have that conversation about what worries us. And maybe it is about having a conversation with our kids.
Yeah, I think it is. I think as parents, I've got 2 young ones as well, and it's just knowing how to have those conversations and really understanding their emotions and how to help them cope with them. And I think there's something as parents you never taught. You kind of just figure out, this is how I did it for myself, so therefore I'll do it the same as with my children. But they're facing a different world to the world that I faced when I was their age.
Yes, of course.
Yeah.
And like FaceTime and things, we can communicate with our school friends using that now, but years ago we wouldn't have been able to.
Definitely. And the playground's a very different place. Even when we get back out of lockdown, it's a very different world than it was 30 years ago.
Well, we spoke to the University of Exeter earlier on as well. So how have they been helping this?
So the programme, so our 2 staff members are on a year training programme with the university. They have a clinical supervisor from the uni. So they support all of the work, and they've helped us roll the programme out. They're doing it with a few other organisations across the city and across Devon. And yeah, the idea is to stop young people getting to the level of needing critical intervention from CAMS and things like that. So it's about getting in a lot earlier on. So yeah, we're working really well with them.
Spotting a problem before it becomes one.
Absolutely. That's one of our values as an organisation, is early intervention and prevention. So we think this is a key piece of work.
Thank you, Gareth. Gareth Sorsby from the YMCA in Exeter. It is 8:30.